Okay. Everyone, my name is Ali Khan. I'm also one of the third-year residents. Dave, I think the Maasai ceremony was a secret, but I think you just let it out, but it's okay.
Sorry, Ben.
So I also went to Tenwek Mission Hospital, which is in Kenya, where David was. And this is a short video actually produced by Tenwek about what the hospital and the eye unit specifically is about.
Tenwek Hospital is a mission hospital in Kenya that was begun in 1937 by an American nurse and has now grown to be one of the largest mission hospitals in all of Africa. The eye department at Tenwek Hospital first began in 1991 as a very small clinic, but since that time the eye clinics had tremendous growth in the ability to care for patients in this region. The Tenwek Eye Clinic runs a comprehensive operation. Outside of the capital city of Nairobi, we're the only place that offers subspecialty ophthalmic care like retinal surgery, corneal transplant surgery, and pediatric ophthalmic surgery. In recent years, Tenwek Hospital has become a major training institution for Kenya and East Africa. And in the eye department, we are training ophthalmology residents from the only ophthalmology residency program in Kenya. Currently, we are seeing over 15,000 patients a year and performing over 2,000 eye surgeries per year. This is a 232% increase in the number of eye surgeries performed since 2005. Despite this significant increase in the numbers of patients that we have seen in the Tenwek Eye Department, we've had minimal increase in our facilities. In September of 2012, we were awarded a grant that will enable us to begin construction on phase 1 of a dedicated eye and dental facility here at Tenwek Hospital. This grant will have significant impact on our ability to care for eye and dental patients here in our region and enable us to more than double the numbers of eye and dental patients we see here at Tenwek Hospital. Finally, this grant will free up space from the current eye clinic to increase the hospital's capacity to care for HIV, malaria, maternal child health, and pediatric patients here in the hospital. On behalf of the 5 million people in the Tenwek Eye Dental Service region, thank you USAID and ASHA for your support in helping us bring American best practices to the Kenyan healthcare system.
Okay, so this is a picture of Tenwek Hospital, and for everyone, this is no small kind of mom and pop operation at Tenwek. It's a full-fledged hospital. They're doing very advanced surgeries. While I was there was a special team brought in for pediatric cardiac surgery there for 1 week in particular, and they're doing, amazing things there, and the eye unit's a part of it. Now, I wondered who's actually at this hospital, and it's a missionary hospital. So there are people there who are called long-term missionaries, and Dr. Roberts and his families are one of them. And there's an organization called the World Gospel Mission that coordinates the missionaries going there, and they have their homes and they raise money to be there. There's also short-term missionaries, and that's what Dr. Cropsey was. There's a program through Samaritan's Purse, an organization where people go for 2 years, and Michael Chen, who's the other ophthalmologist who coincidentally I went to medical school with, who's there now, he's also there for 2 years, just like Dr. Cropsey was. And then the population from Bomet, the rest of the staff in the hospital, clinical officers and other physicians who are native Kenyans are also working there. So this I thought was interesting. This is a kind of a dam right next to the hospital, which provides actually most of the energy for the hospital. They do rely on the local Kenyan power supply, but they're fairly self-sufficient power-wise. And this is the guest house. So when you go as a visitor, like we were, this is where you stay. So as you can tell, the accommodations are very nice. So for our faculty, we wonder, what are you guys doing there? We have a full Monday through Friday schedule, just like we would at Wills while we're there. So Mondays and Fridays are in clinic all day, and then Tuesday through Thursday we're in the OR. And on Thursday afternoon, there's a mobile outreach clinic. I went one afternoon, just as David mentioned. Clinic days go from 8 to 5, just like they do here, sometimes a little later, and the OR days go from 7:30 to 4:30, similar to what we do here as well. So Mondays are the busiest day, so basically everyone shows up on Monday, and anyone who needs surgery gets admitted to the eye ward. And their surgeries are just done Tuesday, Wednesday, Thursday, depending on what the surgery is. You'll get it done on, Tuesday or Wednesday, or you might wait till Thursday. Fridays are primarily post-ops, and then Tuesday through Thursdays, we do have some people in the clinic doing routine visits or anything else that might come through the week. So David already showed a picture, but this is the clinic. You have 5 or so lanes, and all the slit lamps are there. They have a Keeler indirect ophthalmoscope like we have. Pretty much everything you need to get through clinic you have. and you have a full staff of people there helping you sort of translate, nursing students, other medical students there to help as well. This is our little station, so it's an EMR system there, and I might arguably say it's better than NextGen. When you're there, it's a program called MacPractice that Dr. Roberts looked up himself, and it's great. I thought we picked it up in one day, and nobody's picking up NextGen in one day. You have your drops, your lenses, and your EMR. They have a stock room with, the picture's a little blurry, but they have a sort of a dispensary where they have any drops. So if someone, a lot of people with allergic conjunctivitis, you say, okay, you need your Patanol type drop. You go next door to the pharmacy, pick it up, and then you go on your way. And then in the afternoons, they have these things called second opinions. So if Dr. Roberts or Dr. Chen is in the OR or something, but there's a patient they wanted them particularly to see, they sort of wait till the afternoon. So on this side of the picture, this is Dr. Roberts examining a child. This is Michael Chen, the 2-year Samaritan's Purse physician who went to UCSF for residency and UC Davis for cornea fellowship. So between Dr. Roberts, retina trained, and Dr. Chen, cornea trained, you have retina and cornea, pretty much everything in the middle covered. Pediatrics and plastics are probably the areas where they could use some help, and they have people come in specifically to do those cases. So the theater, as they call the OR, like I said, Monday clinic, you're admitted. You get your surgery Tuesday through Thursday. So there's 2 sort of stations. They have Zeiss microscopes. They have Acurus machines to use for vitrectomy. David mentioned, they reuse a lot of materials to keep the cost down, but I was actually surprised by how much they did have, and you sort of get used to some of the tools being not as sharp as you do here, but sometimes I'm glad I didn't have the sharp item because I probably would have gone too far. But everything you have, you need, and Dr. Roberts has been at Tenwek for a while now, and he's done a pretty amazing job of equipping it with what they do need. So there's a lot of other services there that I think a lot of the other eye institutions in Kenya don't have. So they have an OCT, an FA visual field machine. You can get B-scan, A-scan, and keratometry done. Some other places do cataract surgery and just put in whatever lens they have. They don't do measurements before, so there's a lot of refractive surprises. That's not the case at Tenwek. They do have a low vision unit, so some of the people who may have had glaucoma caught too late, they don't just turn them away. They do have services to help them as well. They have an optical shop for refractions as well. There's, I was surprised by how much emmetropia there was in Kenya. Everyone could just see without glasses, but if you did, if you needed readers or something, they have an optical shop to help. So they have what you need. And training. So there's 12 ophthalmology residents in the entire country of Kenya, and each of them do a away rotation at Tenwek for an 8-week period, and they get a lot of their surgical experience there. So Tenwek and Dr. Roberts and Dr. Chen are training pretty much all of the ophthalmology residents in the country and giving them what they do need, the operative experience. There's clinical officers and medical officers who could be sort of akin to maybe a PA who are trained to do cataract surgery, and the clinical officer at Tenwek, David Sawe, is amazing at cataract surgery, and he's a great teacher to learn from as well. They also have a nursing school and medical students there as well. And it's the only place that has subspecialty cornea and retina surgery in the country. So these are things that the ophthalmology residents and even other ophthalmologists come to Tenwek to learn from. So I also thought was interesting was how much things cost for the patients while in Tenwek. So $1, conversion rate, if you kind of fudge it a little bit, it's about 100 Kenyan shillings. So these are kind of the fees. So, a new patient visit is $2. A follow-up visit's $1. An Avastin injection, which I thought was interesting, $45. So things are cheaper. Some things like the Avastin is harder to get. So the cost, when we were at the Arizona rotation in Maricopa County, they charged the patients $50. So it's about the same. Prices are cheaper. And for surgery, the manual small incision cataract surgery is $45. If you do phaco, it's $25,000. So that one patient that David Sauls did paid 25,000 Kenyan shillings for David to do the phaco. But a lot of other people just get the small incision cataract surgery and do very, very well. But they offer the full array, tube shunt trabeculectomy, sutured IOL. This last diagnosis, a PPC, that's a pars plana capsulotomy. They don't have a YAG laser there, so instead of doing a YAG laser, you actually go in with a retractor through the pars plana and just eat up the posterior capsule. So there are some things you have to sort of work with. So what were some of the things that I thought were different about Tenwek compared to what I'm used to here? Patient resources, we definitely have some patients here that don't have many, but in Kenya it's a different level. So some people, unfortunately, do have to sort of save up quite a bit of their money. You know, 4,500 Kenyan shillings is a lot for over there. Equipment and instruments, they were different. Like I mentioned, the pars plana capsulotomy versus doing a YAG here, there are some things you have to adjust. The infrastructure, sometimes the power does go out in the middle of the surgery, so you just take a deep breath and then wait, and then it comes back on. And then the language and culture, and the U.S. is obviously diverse. We deal with language and culture diversity issues, but it's also true over there. So I didn't know about the different tribes that live locally in Kenya, but you sort of approach them differently in different languages. So we had a translator to help us, but I thought that was interesting and unique to that experience. And the same problems, things that I think are similar to what we deal with here, compliance. A lot of times patients don't use their drops in glaucoma. The cornea transplant program I thought was interesting because they're now doing the transplants there, but they're seeing a lot of rejection because some patients are just non-compliant with their drops and follow-up. Operations, the OR turnover was an issue. There was sometimes you waited a long time, and I know a lot of the people here sometimes say, they wish things could be faster. Same thing over there. And logistics, part of the issue, if you move to any different system, is just figuring out what you can and cannot do. So it was the same thing at Tenwek. When a certain problem came in, Dr. Roberts, what do you do with that here? And he told you, and that's what you did. So you just learned the system like you would any new system that you'd be a part of. So looking forward, Tenwek is, Dr. Roberts mentioned in the video, but got a grant from USAID to build a dedicated eye and dental building. And Dr. Roberts is a very humble guy, and he doesn't show that he's very excited about certain things, but I know for a fact he's proud of this, and he's done a lot of work to get this to happen. And with that building, they're also planning to start a residency program. So in this bottom corner here, I think the plan is to actually have kind of dorms and apartments for the residents to stay in while they train. And like I was mentioning, there's only 12 residents in the country, so they could use more people. And the experience they're getting at Tenwek, I think it would be the best residency program in the country, bar none. So this was kind of the plans of the building. This over here is dental, and I think Dr. Roberts is boxing them out as much as he possibly can. Yeah, it's true. That laugh was the truth. But this central area is going to remain, and we actually were talking, do we want to put up the barriers between patient rooms? And I think it really works to not have that. You can have free dialogue with Dr. Roberts and the different students, and actually made teaching a lot easier. But they will add some doctor's offices, some private rooms for pediatrics and anyone who might want to have a private exam. So it's just going to be, I think, a great thing for the eye unit and for the people who are going to benefit from it, the patients. So this was my surgical log. I didn't quite take out as many eyes as David did, but I did do a lot of the small incision cataract surgery, and I was very happy. I got to do a lot of retina surgery with Dr. Roberts. So I'll be starting retina fellowship here, and it was kind of a great, kind of let me relieve some anxiety about starting next year by doing some cases with him. I also got to do some ROP screenings in person with Dr. Roberts and some lasers and Avastin. So it was a surgical experience I don't think I would have gotten here just because we don't do some of these cases, and looking back on it, very appreciative of the opportunity. People ask me about the budget. It does cost a good amount of money to go on these trips. This new thing that Will's residents in the past hadn't done, I think just because we forgot, honestly, but you do need a Kenyan visa, a Kenyan medical license, and a special visitor's pass while you're there. So all of this included, and this doesn't include souvenirs or anything else I sort of bought on the side. The total budget was about $3,000. So the Alumni Society donates to us $2,000 each, and it wouldn't be possible, I think, for a lot of residents to go if we didn't have that extra support. So thank you to the Alumni Society for doing that with us. And there is a cost out of pocket for us, and I'd happily pay it again, even more to go. So Tenwick, these are some pictures. This is the Mennonite guest house. So when you arrive in Nairobi, you stay one night in a guest house there before moving on to Bomet, where Tenwick is. It's about a 3.5-hour drive. But it's a beautiful place that you stay in Nairobi for one night. This is the scene outside of Kipenji. It's a local town where I did my health screening, the mobile clinic, and it's nice. This was a walk around Tenwick, just a random double rainbow that day. There's a lot of tea and wheat fields around Bomet. I didn't know that's kind of how it would look, and it's beautiful. This is a video of a local mountaintop called Motigo, where you get 360 views of sort of the surrounding areas. The video doesn't really do it justice of how nice it looks. So my future plans, I'd like to do future medical trips just like this if I can. Dr. Regillo mentioned us. I think I have to give my first donation to Wills to the Retina Service. That's what Dr. Sivalingham told me. But after that, I would give it specifically to support residents going on wire, if I could earmark it, because I think it's that important. I'd support Tenwick. I didn't know that Dr. Roberts goes on furlough every 4th year, so there's a year that he's not there. So while he was gone, Dr. Cropsey was the new Dr. Roberts kind of for a year. And they do have an interest in keeping retina going, so when I actually can do these things remotely as close to as good as Dr. Roberts can do, I'd like to go to fill in for him one day. And this last part, I think what can Wills do? In starting the new residency program there, I think we have a unique opportunity to help them out with developing their residency program. Educational materials and lectures and what we have done here for a long time, I think could help them. So I hope we do that. And this is all, I don't know why this went back. I'd like to say thank you to Dr. Roberts. It's good seeing you again. I was only there 2 weeks ago, but I miss spending time with you and everybody at the iUnit. Michael Chen, again, was random. I went to med school with him. I did not expect to see him again in Kenya, but that's where I saw him. To the whole iUnit who welcomed all of us there. Again, the Maasai ceremony at the end, I think, was a secret, but now everyone knows. And then to Dr. Feldman, Hanish, and Dr. Haller, who checked in on me while I was gone to make sure I actually got there. And to the Wills Eye Hospital Society for making it possible for us to go. So I think we're going to save questions for later, but thank you for the opportunity to tell you all what we did, and thanks again, Dr. Roberts, for Skyping in. I think,